Okay, hello to everyone. I'm Dr. Mete Toptaş from Turkey, Istanbul. A good day from Istanbul, a shiny day, but we are at home, stay at home because of the COVID-19. You know the pandemic. Okay, and hello to everyone. I would like to thank you to Dante to make this presentation to reach you from the most countries. But we are at home. And I want to start my presentation about the preventive protocols for dental clinic with COVID-19. You know that they are daily life interrupted by the coronavirus, and we are trying to adapt this novel situation. Now I know that you are not doing not regular works, and most of the countries closed, and our dental offices closed. But in emergency cases, some urgent cases, we try to work, and too many questions about that, how we work, what's the protection measures, and in a scientific way, what we do in the standard protocols. I try to give a presentation about that. Let's start with what happened. How is this situation happened? COVID-19. Firstly, 29 of the December 2019, the first report from the Hubei province, the multiple pneumonia occurs some of the patients, and they didn't know why doing this. And after the research, the China announced that the 7th of the January 2020, they first described of the disease caused by the coronavirus, and this firstly described the 2019 new coronavirus. But the subjects and the cases is getting increased, and some deaths, the loss of lives occurs in China, and spread to all over the world. The World Health Organization announced that 12th of the March, this is a pandemic. After this pandemic release, today, the confirmed cases for the coronavirus all over the world, 2.5 million people infected, and unluckily, 172,000 people died all over the world. In the Turkey, the infected cases is reached nearly 100,000 patients, and the 2,000 is lost their lives. Okay, what's this COVID-19 or SARS coronavirus 2? What's this? We are not. We know the coronaviruses many years. The human coronavirus symptoms is more not effective like this. But in the 2002, SARS identified a severe acute respiratory syndrome. This is caused by the coronavirus. And 2012, we are faced with the MERS. Is caused from the Middle East. The coronavirus, the SARS is the mortality rate is 9%. 2002 and 2003 occurred in the China, and the MERS is occurred in the Middle East, and the mortality rate is very high, nearly 34%. This high mortality rate is very scared, but this spreading rate is very low, and in the SARS is very low, and in the MERS is very low. But novel coronavirus, the spread form is very, very high. This new coronavirus, the SARS coronavirus 2, originated from the zoonose, China's horseshoe bats, and high rate of transmission with the droplets from symptomatic patients, asymptomatic patients, patient in incubation period or recovering phase. This incubation period, 4 to 7 days, average is 5 days. When a person contact with this virus, the symptoms occurs in 5 days later. These days cooled up to the 14 days. It's very long time. And the SARS-CoV-2 identified as a respiratory secretions, gastrointestinal tracts, saliva, urine, and the stool. This is why important, because this coronavirus infects cells through the angiotensin converting enzyme 2 receptors. It is mostly these receptors density is mostly in the upper tract of the respiratory systems, and we can see it on the tongue. This is why we are under a danger for the coronaviruses. During the 10 days, which patients are asymptomatic and highly contagious, the infection is located in the upper respiratory tract, generally mouth, nose, and throat. But day by day, the following days, subsequently, as the disease progresses, the virus moves on to the lower respiratory trunks to lung. Symptoms is related to this way, and some of the coronavirus symptoms, the disease is named as a Covid-19, and we now say this is a Covid-19 caused by the coronavirus. Some symptoms and small symptoms is related this way of the infection. Potential transmission is route by the saliva and aerosolation from the infected patients you see in the picture, particularly relevant in the dental field. This is why important for us, because if infected patients with sneezing, coughing, or with the speaking, the droplets come to the airborne, and the susceptible individuals could be infected from this infected patient if there is no protection mask. Even in the dental practice, we are using the aerosolization instruments like aerators or the other tools are using, makes the droplets and aerosols. These aerosols directly contact to the dental professions or dental assistant or the doctor or the other staffs. And the another way, infected patient contaminating the dental instruments indirectly, and the indirect contact with the dental profession. Even with the indirect contact, and not only the dental professions is under danger, the other individuals or the other patients cross contamination risk. Now we see the total infection in Turkey, nearly 100,000, and infected healthcare workers totally 3,000, nearly 500. This rate is 3.5%. Even all of the patients, infected patients, 3.5% is healthcare workers. This is a very high percentage. And if we are working in our offices, we are in danger very strongly. Okay, what we do for during to prevent ourselves, prevent our staffs, and prevent our patient to add a new infection spread to another person. we have to care some of the protocols. I will explain it before the dental care, during the dental care, and after the dental care. During the dental care, dental healthcare personnel check is important. Firstly, we have to do this. First, assessing the dental healthcare personnel about the risk group. Risk group means that your staff, you or your assistant is in a higher risk group for the COVID-19. Is their systemic health status? They have hypertension or diabetes or cardiovascular disease. This is the main questions. And the second one, is there any immune suppression using by your staff or you or your assistant, or is they are over the 65 years old, the high risk group for the COVID-19, if infected, to probably lose their lives. Is it possible or not? The second one is self-monitoring of the dental health care personnel. What it means, before the dental procedures, we have to check ourselves. Is our dental health care profession has a fever or coughing or sneezing or difficult breathing or muscle aches? Is there any influenza-like symptoms occurs of the dental health care providers or professions? We have to evaluate it, and we can't make any risks to potential infection to our patients. The infections doesn't only comes from the patient. Maybe if we don't have any preventive protocols, maybe we can spread to the patient. This is awful. And the third one is to check the availability of the personal protective equipment, because nowadays the fighting to the COVID-19, the personal protective equipments reducing fastly, and to reach these equipments is sometimes not. We can't find the personal protective equipment. Because of that, we have to ready to for our patients. We have to check the availability of these personal protective equipments. What's this? The masks, caps, and gowns, and some of the specialized masks, face shield or glasses. Okay, the second one is the patient waiting room adaptation. What's this? Because you have to evaluate your waiting room to novel situation. Please schedule your appointments for minimize the patient contact at the waiting room. Maybe your procedures will take half an hour or 1 hour. Maybe you can give an appointment for 1 hour and half an hour, maybe, or 2 hours. You can accept the patients with 2 hours. Yes, I know it's very difficult, but we are talking about the emergency case, and we are talking about the emergency case. And minimize the patient contact materials. In the waiting rooms, magazines, toys, and the other objects can cause the infection, cross-contamination. If a patient, asymptomatic patient, or recovering patient, maybe we can't realize, touching some materials, and after that, a healthy person could infected about these objects. Because of that, we have to minimize the patient contact material. The third one is to maximize the digital workflow. maybe we can create the appointments with digitally and minimize the contact with the patient and its companion. And maybe consent forms fill with the digitally and only one signature. I know the under law we have to sign. We have to give the consent, and the patient has to sign it. But we have to minimize all the touch and the patient cards maybe. And the waiting room environment replies for the keeping the social distance. If a patient has to wait in the waiting room, maybe with companion or alone, we have to keep the distance between the staff and patient, or the patient and its companion, or patient to patient, 1 or 2 meters. And please ask the patients, if they are waiting in the room or your companions, to wear the mask. Possible infection risk. And the creative patient companion rules, required or not required. You can inform your patients to come to office with alone, or if they are child or disabled person, you can ask them to make one companion to come with to come to office, and to make the rules for about that. The third one is the important one is triage, the patient triage. Most of the countries, Ministry of Health release some restrictions, and I know that some of them, like Turkey, the Ministry of Health recommend us postpone all the elective procedures during the COVID-19 pandemic. Please accept the only emergency procedures. The emergency procedure rules relates from all the countries' Ministry of Health. In Turkey, the life-threatening treatments and the life-threatening problems and severe pains causing from the dental diagnosis or swallows is including the emergency procedures. If an emergency procedures, if you in emergency procedures, please firstly interview with the patient with the phone, text, or digitally to make the contact minimum. If an emergency and urgent dental patient has, we will see at the diagram how we assess this patient. The main problem is recovered patient. If a patient has a history from the COVID-19, how we accept this patient? There are some rules. During the interview with the patient, we have to make sure that after the infection, the healing phase is nearly 14 days. Is this patient isolated himself or herself at home at 14 days? And two negative tests, can they show at 2 negative tests? Because of that PCR or immunoglobulin. The PCR test is very safe, and or another more rapid test they can do, but we have to care about the 2 negative tests. If a patient is an urgent patient or an emergency patient, we have to settle a protocol. This patient has a fever. Yes, this fever is associated with the dental diagnosis. Yes. Is there any other symptom of the COVID-19? No. We can do the treatments. But this patient has a fever, and this is associated. This is not associated with the dental diagnosis. We have to stop all interview and we have to send the patient to COVID-19 hospital or the health care providers. If a patient has no fever, but also he has other symptoms of the COVID-19, like illness symptoms, sore throat, cough, difficult breathing. If this question's answer is yes, we have to stop the interview and send the patients to the COVID-19 hospital or healthcare provider. The best one is the patient has no fever and no symptom of the COVID-19, the other symptoms. We can do the treatments, the emergency treatments. Okay, what's the preventive protocols during the dental care? Now we evaluate the patient, we make the triage, and we check our all the preventive personal protective equipments, and check ourselves and check our staff's condition. If we are in a good condition and our environment is in a good condition, we decided to do dental procedures. Okay, during the dental procedures, dental care, we have to settle the standard precaution and personal equipment. What's this? The first one is apply the regular infection prevention practices. This is the safe injection practices, hand instruments, surface disinfections, hand instruments disinfection and sterilization, and the patient cross-contamination precautions. We have to do it regular. What you are doing in the regular days, the regular workflow, you have to implement this right now. Okay, the second one, you have to add some new protocols. The first one is room isolation. During the dental performance, you have to isolate the room to protect the other staffs and the patients in the waiting room, maybe, because our treatments during the performance, aerosols could occur, and these may affect the other peoples. Because we are wearing the protective equipments, maybe we are under the safe conditions, but in the other rooms, maybe not. And we cannot, we can isolating the room to protect the other staffs and the people. And let an adequate ventilation of the room. What it means, some of the papers shows with the air condition, some spread of this infection. Maybe the fresh air, the open window and the fresh air is more effective in this during this pandemic. The third one is the important one, is the protection of the mucous membranes, nose, eyes, and mouth during performing, generating, splashing, and spattering. You see the picture how to wear the protective equipments. First one is hand hygiene. Please take care about the hand hygiene firstly. The second one, protect the gowns wear, and the mask wear, and the third one is glasses, and the fourth one, the other one is face shield, and the end of all the equipments wear, the glove wear. Okay, you see the personal protective equipments. The recommended one, in the European regulation, FFP2 or FFP3 masks is liable for this pandemic to protect yourselves from the virus. This in the US regulations, and 95 masks. This codes in European FFP2 or FFP3, in American regulation, and 95 masks. And surgical mask over the FFP3 mask, and wear a solid side glasses to protect your eyes, and a face shield to protect all over your face, and wear a disposable gloves and caps. You see an example of the wear. One thing, these equipments wearing is important for suspiciable. We are suspect all the people could be a COVID-19 patient. But if a confirmed COVID-19 patient, we has to do something to some treatments to the patient, maybe we more upper equipments we can wear, like water shield equipments to cover all over the our bodies, and we can wear more two and FFP2 or 3 mask like this. Okay, we do all our protective, we wear all our protective, personal protective equipments. The second one is during the dental care, what we do. The first one is use of the pre-procedural mouth rinse, because the patient could and carry COVID-19 coronavirus. During the first 10 days, the infection is located in the upper respiratory tract, mouth, nose, and throat, and the patient is highly contagious. And potential transmission route by the saliva and aerosolation from infected patients, particularly relevant in the dental field. SIRS COVID-2 viral load is directly associated with the severity of the COVID-19. Related of this, the oral cavity is a potentially high risk site for the infection by the SIRS COVID-2, coronavirus 2. The reduction of the pathogenic load is in the oral cavity would help to reduce the severity of the COVID-19 disease. To prevent the pre-procedural mouth rinse, to prevent ourselves and the environment, we can use the cetylpridinium chloride. This is highly safe antiseptic for the daily use even, and it fights the plaques, and substantivity is from 2 to 5 hours. The broad spectrum, you see the different types of bacteria, fungus, and some viruses. In vitro and in vivo studies, cetylpridinium chloride have a virucidal and preventive activity against some viruses, including some strains of coronaviruses. Let's see what's the evidence based, what's the papers about the cetylpridinium chloride. The cetylpridinium chloride alters the lipid membrane of the viruses with a lipid envelope through physicochemical interactions, causing their rupture and, in turn, the inactivation of the viruses. You see at the A control group, and B and C. B and C, after the 5 minutes application of the cetylpridinium chloride, the effective of the inactivation of the viruses. You see in that 86% of the viruses are inactivated. When the comparing of the control group, very high solution we could see. And other research, Muharji and their relatives, clinical trial conduct 94 healthy volunteers evaluated for too many viruses. This evaluation is making not only coronavirus. This evaluation is to prevent the from the patient against the viruses with the upper syndromes, upper tract syndromes. You can see at the table 2, the CPZ is effective in the prevention of upper respiratory infection by the viruses with a lipid envelope. A coronavirus is a lipid enveloped virus, like SIRS and MERS. Okay, how can we implement these evidences to our clinic. In periodic intensive care, chlorhexidine and cetirizine chloride together. You can use the preprocedure mouth rinse, minimum 15 milliliter periodic intensive care mouthwash. Put a glass and ask the patients to rinse his mouth or her mouth with 1 minute. Please do it minimum 5 minutes before the start of the procedures, and no mix with the water, and no rinse after the application. During the performance, cleaning of the mouth with period recommended, highly recommended, to remove the active ingredients. Another paper I want to show you. This is applied for the publication. This paper is anesthesia and is a paper of the anesthesia. You can see at the step 3, patient decolonization. Before the intubation, use of the chlorhexidine mouth rinse recommended for all the patients, not only the dental patients, for the general anesthesia. The second one, we accept the patient, we check our sterilization, we make our all personal protective equipments, and use the mouth rinse before the procedures. The second one is we start the procedures. We are preferred to choose extraoral radiographies to not activating the saliva, and to reduce the aerosol production as much as possible. Possible minimum working time. Using rubber dam is better to creating an aerosolation from the patient's mouth. Working four-handed technique is very important. Your assistant must use high volume evacuators for the minimized aerosolations. And if you performing surgeries using the resorbable sutures is necessary, if necessary, use the resorbable sutures because of the following to reduce the following appointments. If it's not necessary, please avoid the patients to following appointments, and minimize the 3-in-1 shrink, because when you are pushing, an aerosolation occurs. To minimize it, use it minimum numbers. Okay, between the patients or after the procedures, what we do? Cleaning the reusable personal protective equipments with soap and water, and after disinfect with disinfectants. This is very important, because nowadays it's hard to find it's difficult to find the personal protective equipments. If we use it more long, our resources decreased not fastly. Non-disposable equipments, according to manufacturers' instructions, remove the debris, clean and sterilize, and cleaning and the disinfection procedures of the surfaces, and minimum 30 minutes between the end of the patient to the new patient. You finalize your procedures and make your disinfections. Please let the environment, all the aerosols down to the floor, and ventilation, an adequate ventilation of the room to the new patient. This means 30 minutes is maybe effective. In the picture, you see how you put out your protective equipment. Firstly, remove your gloves. The first glove. Maybe you can use 2 gloves. The second one, hand hygiene. Please, if you are infected, contaminated with the saliva or the blood, wash your hands 20 seconds minimum with the soap and water. And after that, use minimum 65 or 70% alcohol, including disinfectants, and remove your glasses, face shields, and after face shield, remove your gowns, and at the end, remove your surgical masks. My advice to use the N95 masks, not remove these masks. Please use it during whole the day, because to protect yourself, to when you are coming to office, you are wearing your FFP3 mask or FFP2 masks. Please change only the surgical masks. Please use the FFP3 masks. Wear your mask. Over the FFP3 mask, use a surgical mask. And change every patient your surgical masks. And the other questions, the cleaning of the surfaces. We are talking about at the first the indirect contamination. To stop the indirect contamination, you can see the persistence of coronavirus on inanimate surfaces and their inactivations. You can see on steel, aluminum, wood, and papers. This is a new research. From 46 hours to 7 days. It's a huge time. To inactivate it, too many ingredients working. Human coronaviruses can remain infectious on inanimated surfaces for up to 9 days in this paper. Surface disinfection, 0.1 sodium hypochlorite and 62 to 71 ethanol significantly reduce the coronavirus infectivity on the surfaces. To exposure time is nearly 1 minute. It's very, very close, short time. In this paper, in this research, they are expecting a similar effect against this SARS coronavirus too. Okay, after the patient come, we evaluate it, and we decided to do a treatment. After the treatment, we put out our equipments and disinfected the office, the performing room. Now we, after the procedures, we do recommendations to our patients. Staying at home, maybe the patient can stop their oral health hygiene. They can stop. We advise to maintain the daily oral health care when they are staying at home. Use of the CPC to reduce the load of the SARS coronavirus in the mouth. And the filaments can be an ideal medium for the retention and the growth of the pathogens. So what we do, rinse and shake off the brush to eliminate the excess water. Use cap with a ventilation. Store in upright position your toothbrushes and keep brushes from touching each other at home to not infect any other person, and replace brush after infections process. This is very important. If a patient has like a flu or coronavirus or another infections, to protect the reinfections, it's very important to replace and renew their toothbrushes. Which kind of products we can recommend to our patients, especially including the cetylpyridine chloride? The periodic intensive care, the periodic active control after the treatments. For daily use, we can recommend to Vitis gingival to our patients, or if an orthodontic patient, we can recommend the use of the toothpaste and toothbrush of the Vitis orthodontic, or regular use for the halita. For all the protection measures and the other recommendations to patient, as personally, we have to care some preventive protocols for us, for ourselves. The washing hands, the minimum 20 seconds is very important, and coughing to our arms, inside our arms, and use napkins. If you have a coughing, you call the emergency lines. Is very important. If your COVID-19 is early start the treatment, maybe protect yourself for the future, and please protect your oral health and general health with daily use of the toothbrush, mouthwashes, and please protect yourself, please protect your patients, and protect your nation. Thank you for listening to me, to attending these presentations. Now I finalize my presentations and I'm waiting your questions. Thank you. The pandemic, and hello to everyone. I would like to thank you. We are at home, and I want to. Okay. I see a question. Is chlorhexidine by itself, without CPC, effective enough for the preventive care? For the chlorhexidine, there is proofs and research for the effective against too many bacteria and the fungus and some of the viruses, but the main research focusing on the CPC. If we place it together, it's more useful. I have to say that we are evaluating this in a evidence base. The research show us the CPC is effective itself. If you bring with the chlorhexidine, it's more effective. And also, you can see the peroxide's effectivity against the bacteria is the chlorhexidine plus CPC is superior effect than only the chlorhexidine. Because of that, my advice to use the chlorhexidine including with the CPC. And another question regarding using a mouth rinse before procedures. What do you think about the peroxide hydrogen mouthwash or povidone iodine mouthwash? Are they effective as well? In many countries, Ministry of Health and or Chamber of the Dentistry release some papers about these preventive protocols. when we are assessing the American Dental Association, the pre-procedural mouth rinse use, they recommend the hydrogen peroxide and povidone iodine, but at the end of this, they said there is no evidence about the use of the hydrogen peroxide and the povidone iodine. There is no strong evidences and research about that. For the dental and the dental care and the aerosolation procedures. But the CPC is proven with the scientific way. And when I'm searching some papers, there is strong complications with the povidone iodine. Swelling is not a problem. When we are performing the aerosolation, the povidone iodine aspiration causing some serious symptoms, complications with the patient. Hydrogen peroxide is more safe, but the safest one, the commercially the safest one, is the cetirizine chloride. The use of the cetirizine chloride is evaluated with the scientific way, and I think the use of this one is more effective than the others. But in the anesthesia paper, you can see the use of the nasal wash with the povidone iodine. Because of that, you can use with the povidone iodine. After that, chlorhexidine maybe, if you want to use. And I think there's no more questions. We can finish in one list, sorry. Patients who are recovering from the COVID-19 appear to suffer with dry mouth amongst other things. Do you have any guidelines on post-COVID-19 for this patient? You know that the dentate has a product for the dry mouth, Xerox. Also, for the cancer and oncology patients and the ears, nose, throat, dry mouth syndromes, we can recommend the Xerox also. For this patient, maybe we can recommend the Xerox for use mouth rinse and provocate their salivation. And yes, that's a good question. Do you think we need to take patient's temperature before treatment? Yes, you see on the in the patient triage, recommend is if we are accepting the emergency or urgent dental patient, we have to take the patient's temperature. If the patient's temperature 37.3 or upper, we accept this is a fever. It could be associated with the COVID-19. If has a fever, and this fever associated with the dental diagnosis, okay, we have one question more. Other symptoms occurs in this patient. Is this patient have a sore throat, cough, or difficult breathing? If the answer is yes, we stop the treatment, send it to hospital. Or no, we even in this fever, we are accept this patient, this fever causing from the dental diagnosis, dental problem, emergent problem, we has to start the treatment, a prescription or a direct treatments. You know what you are doing. The third one, another question, doctor, at what is the earliest age the patient can use the mouthwash with the CPC for daily use? You know that for the CPC, for the CPC, you can use nearly 10 or 12 years. And you can find in these products in the dentate children range. Dentate children, Vitis Junior has a CPC. And the patients can use them for the daily oral health care. Okay. Dr. Donia, thank you for your good message. In Poland, specialists strongly recommend to use hydrogen peroxide or the mouthwash containing alcohol and chlorhexidine as the only safe against the coronavirus. We got questions whether the dentist should add some. Okay. In my presentation, I show you some evidences, the papers. Maybe I can send you by the mail if you write. These papers shows that the CPC affects the lipid enveloped viruses like coronavirus very strongly and reduce the load of the viruses. You know that if a virus change to disease, the virus load has to be increased. If you try to control it with CPC, you could be effective. Hydrogen peroxide, not so much evidence-based research to support this. For the surface disinfection, maybe surface disinfection, but in the oral mucous membranes, I'm a periodontologist. Many years ago, to acute necrotis and ulcerative gingivitis treatment, we used the hydrogen peroxide, but the research show us its harmful effect. We change our protocols to chlorhexidine. So, alcohol is associated with the oral cancers by daily use. If you are using too many products, including the alcohol, the percentage of the oral cancer occurs more than the not using. So, the CPC or the chlorhexidine not containing the alcohol is the safest way to use the daily oral health. After the treatments, especially after the surgeries, the alcohol's harmful effect, we are not choosing the alcohol ingredient products. So the CPC and the chlorhexidine is the perfect ingredient to use against the bacteria. For the viruses, these evidences show us the CPC is enough to control the viruses. But if you want to do not impossible, do your hydrogen peroxide, and after that use also the CPC, because we know with the research the safest one is the CPC. My colleagues say the last ones, and I would like to thank you. I hope it's useful for you, and I hope to protect yourselves and your patients and your staffs at the clinic and their daily lives, to informing them. It could be useful, and I would like to thank you again and see you maybe in another presentation. Have a good day.